Let's move to the final section of our symposium today, which is the tutorial section. Let's go ahead and get started with that. And just as a reminder, if you can download the HipScreen app, you'll get the most out of this tutorial because we will have a hands-on session at the end. Now, although this is a pre-recorded session, please do give your questions and feedback in the chat box so that we can respond live. I have no disclosures. Hip surveillance assesses the whole child at each of the hip surveillance visits, including an assessment of their function, a physical exam, and finally, at selected visits, radiographs as well. Now, from the provider's perspective, some of the guidelines when read can appear too complex. Some people say they don't know how to read an X-ray, and so the major way to make referrals are outside of their grasp. And those that do measure X-rays find that it takes too much time to actually come up with the calculation of migration percentage. And finally, we've heard the feedback of many people who have found that radiologists don't often measure the migration percentage, but will just give a qualitative assessment of the hips. And all of these are barriers to implementation. Now, when we're taking a trip anywhere, very few of us, I would think, actually break out a paper map to find our way. What do? We open up our smartphone. And so having the knowledge at your fingertips is key. And so we developed the HipScreen app and the HipScreen.org website with this in mind. And I'd like to give you an overview of the resources that are available. First, there's educational material in the first tab of the HipScreen app that contains information on hip surveillance, how to interpret a hip surveillance X-ray. There's also a radiology protocol that can be given to a radiology department so the child is properly positioned and the X-ray is properly read. And also, there's lots of information, including full text surveillance guidelines and CP classification systems. Secondly, the second tab allows you to choose the child's level of function, and then the CP Academy Hip Surveillance Care Pathway recommendations are there. So that, for example, a GMF-CS3 child needs a pelvis X-ray and clinical exam every year between the ages of 2 and 8. And it's right there at your fingertips. Finally, the most novel aspect of this app is the ability to directly measure X-rays off of your device. Now, a lot of people have concerns about medical privacy, and any photo that you take within the app does not get stored on your device. And when you close the app, it disappears. So, and it does not communicate the image to any central server. So that was all done to allay some of the fears of medical privacy. This tutorial, as well as a host of other resources, are on the HipScreen.org website. And there's also additional resources on how you can improve your accuracy using the HipScreen measuring tool called the HipScreen ruler, as well as how to better understand the hip surveillance guidelines. So we hope you check out the website. As we've mentioned before, the migration percentage is really our cornerstone to early identification. And this is obtained with a supine AP pelvis X-ray that establishes the migration percentage for both hips, with a radiation exposure that is just 1/5 of what you would get by living at sea level annually. 30% is our critical number for migration percentage where a child should be referred to a specialty center for further treatment and evaluation. Now, not all of us are on the same page in terms of interpreting X-rays, and so let's learn the language of radiology together. X-rays are presented on the screen as if the child is facing us, and so the right hip and the child's left hip are labeled here. Also, the terms medial refer to the center, towards the center of the body, and lateral refer towards the either side of the body. And then particular features on the X-ray can also be described as medial and lateral, as you can see here with the femoral head. Let's go over the technical descriptions of the hip joint. The ball of the ball and socket joint is the femoral head ossific nucleus in children that have not achieved skeletal maturity, and it's outlined here with the dotted lines. The acetabulum is outlined here and is the socket. And the acetabulum can be divided into two sections. The acetabular source seal, which is the weight-bearing surface of the acetabulum. And then the acetabular teardrop, which is a U-shaped structure that represents the medialmost portion of the acetabulum. Let's now get into the steps for calculating the migration percentage. The first step is to confirm that you have a properly positioned AP pelvis X-ray. As you can see, the child is positioned with the pelvis horizontal and the neutral leg position with the patella facing forward. An additional important aspect is that if there is a hip flexion contracture, that pillows should be used underneath the legs to allow the pelvis to maintain its position facing forward and not be tilted forward. This is an example of an appropriately positioned AP pelvis X-ray with symmetric pelvic wings, neutrally positioned hips and femurs, and symmetric and oval obturator foramina. Now we've taken the same X-ray of a child, it's a CT scan in an X-ray format, and have rotated it to show you how some rotation and tilt can change the ability to properly establish the migration percentage and the identification of landmarks. So the example on your far left shows the appropriately positioned X-ray with symmetric pelvic wings, symmetric oval obturator foramina, and femora that are in neutral. When the child is rotated, you start to see asymmetry of the pelvic wings, asymmetric obturator foramina, and femora that are held abducted. Finally, if the child has hip flexion contractures and placing the legs without the pillows draws the pelvis anteriorly, you get an inlet view of the pelvis where the obturator foramina are no longer oval shaped, they're harder to see, and the landmarks around the hip are also difficult to visualize. The second step is to recognize that not all children are laid exactly square on the plate, on the X-ray cassette. And so we have to establish the horizontal of the pelvis by creating a horizontal axis line or an H line. This connects pairs of landmarks on either side of the pelvis to establish the horizontal. And I'll go over each of these landmarks in the subsequent slides. The best landmark to use is the triradiate cartilage. This is the space between the bones of the pelvis at the center of the hip joint. And that's the reason why it's the most effective to use because it's closest to the hip. And we use the same part of the triradiate cartilage to connect the two sides of the pelvis, here shown as the lateralmost aspect of the triradiate cartilage, as shown by the orange arrow. The bottom of the the bottom of the acetabular teardrop can also be used, as can the most inferior portion of the ischial tuberosity, or the most superior portion of the iliac crests. Once we have the H line, now three perpendicular lines are drawn. The M line touches the medial aspect of the femoral head. The P line touches the lateral edge of the acetabulum, which is usually the edge of the source seal. And the L line touches the lateralmost edge of the femoral head. And once that's done, the migration percentage can be calculated as distance A divided by distance B times 100% for each hip. Now, this can be done on a PACS workstation where vertical lines are drawn, and then you break out your calculator and you can calculate your migration percentage. If you have access to a computer-aided digital templating system, you can use the tool, which helps simplify the movement of the lines, and the calculations are done automatically. But the HipScreen app, embedded within it, is the ability to do it for free off of a computer screen and get a very high level of accuracy, as I'll show you. So you can rotate the pelvis so that the H line is now horizontal. Then you activate a ruler. And when you do this, you position the femoral head as follows. The medial aspect of the femoral head should touch the black line. the lateral aspect should touch the white line. And here for the right hip, we're using this half of the ruler. Once the femoral head is positioned like this, it's divided into 10% increments by the vertical lines. And the third vertical line from the edge, or the white line, is the 30% line. That shows us if the migration percentage is more or less than 30% very easily. Here, the lateral edge of the acetabulum touches the first vertical line, so the migration percentage is 10%. Let's continue with the video, and you'll see utilization of the other half of the ruler for the patient's left hip. Again, we're going to expand the image using the touch screen until the lateral aspect of the femoral head touches the white line, the medial aspect touches the black line, and now the edge of the acetabulum is 10, 20, 30, 40, 50, a little bit more than 55. Maybe we can even say 57%. So the migration percentage here is calculated at 57%. We've published that this method of migration percentage measurement is as accurate as using a computer-aided or manual digital measurement on a full-sized computer. It has excellent reliability and is faster than doing manual measurement on a PACS workstation, as shown with that first example. One of the nice features of the app is also the ability to quickly see whether the hip has a migration percentage over or under 30% by using this red box. And so if the edge of the acetabulum is outside the red box, as in this example of 15%, it's you know that it's under 30. Here's an example of an acetabulum that's exactly at 30%, so it lands on the edge of the red box. And then the hip on the other side has a migration percentage close to 50%. And you can see here, the edge of the acetabulum is inside the red box. So either hip, as you're measuring, if the edge of the acetabulum is inside the red box, it deserves a referral to a specialty center. Okay, now it's your time to break out your HipScreen app, and we'll go through step by step using some example x-rays. And as we go through these x-rays, I hope that you in the chat box will put what you think the x-ray measurements are. The answers are actually there on the hipscreen.org website, so try not to cheat to get the most out of this tutorial. So let's start with example number 1. Go ahead and take a picture of this x-ray with your device. And then I'm actually going to lead you through how it's done in this next video. So the first thing that you do is you press the migration percentage ruler icon. That'll open up this icon for the camera feature. Then you'll take an image. So get up close to your computer screen, try to have it fill the whole screen in landscape view, and then take the picture and then use the photo. Once that is done, you can expand the hip so that it fills the screen, press rotate. And now CCW means that it'll rotate counterclockwise. With taps, CW is clockwise, and then you can hit done. And then now engage the ruler by pressing the ruler button on the bottom of the screen. And now use the touch screen to expand the femoral head so that the lateral aspect touches the white line, the medial aspect touches the black line, and try to get the edge of the acetabulum in view. And then you can mark down on a piece of paper what the migration percentage is, and then move to the other side. Again, engage the ruler, expand the femoral head so that medial touches black, lateral femoral head touches white, and examine where the edge of that acetabulum is in relation to the white line. You should find that the right side was somewhere between the edge of the acetabulum is somewhere between the 6th and the 7th vertical lines representing, between the 7th and the 8th vertical lines representing approximately 75% migration percentage. And the left hip is somewhere between the 3rd and 4th vertical lines representing a migration percentage of 33%. So we did that example together. Let's go ahead and actually try to have you do the second example. So there'll be a bar on the bottom showing us how much time we have for you to take the picture. So go ahead and choose migration percentage ruler and then camera, and then take a picture, get as close to the screen as you can. Try to do it in landscape mode so that it maximizes it on the screen, not in portrait mode, but landscape. Okay, hopefully you've taken the picture by now. And now let's go through the steps of this process. And as I'm going through the steps here, you can enter in the chat box what you got for each hip. So again, you'll press the camera icon, take a photo in landscape mode. Now use the photo. You'll press the rotate button after expanding the image. Tap it to rotate it, both clockwise and counterclockwise, until the line goes through the middle of the triradiate cartilage. Then activate the ruler. And I'm going to show you on this example a nice trick that you can do to better place the femoral head appropriately. So now we get a provisional sense of what would be the best position for the femoral head on the ruler. Now you can tap the ruler on and off, and that will help you see whether your landmarks are accurate. And then once you've made that assessment, you can move to the other side and place the femoral head using the other half of the ruler. And then similarly, you can, before you make a final assessment of the migration percentage, tap the ruler on and off so that you know where the edge of the acetabulum is located. And then hopefully for this example, on the right side, you got a migration percentage close to 50%, and on the left side, close to 30%. Let's go to our final example now. So we'll give you about 30 seconds to activate the ruler and take a photo. And let's now, at least as far as the chat box is concerned, enter in the value that you think that is a migration percentage for the left hip, the patient's left hip. Okay, hopefully that was enough time for you to take a photo of the X-ray. So let's go through the how it was done here again. Press the migration percentage ruler. Take a photo using the photo icon. Now you can try to level the image a little bit yourself before you take the photo to save you a little time on the rotation step, as I did here. You can use the photo. Now use the pinch zoom feature on the touch screen, touch rotate, double check your landmarks, rotate it a little bit one way or the other using this counterclockwise and clockwise buttons. Press done, engage the ruler, and now expand the appropriate, using the appropriate half of the ruler, expand the femoral head. And then you can turn the ruler on and off, the ruler overlay, so that you can get a sense of where the edge of the acetabulum is and making sure that you have all of your landmarks appropriately placed on the ruler. And then you can move to the opposite hip and engage the ruler, expand the femoral head on the other half of the ruler so that medial touches black, lateral touches white, and now you can assess the edge of the socket. So the right hip, the patient's right hip was about 20%, we think, and the left hip was between the third and the fourth vertical lines, representing approximately 35%. So I hope you found that tutorial helpful. In an online environment, it's a little bit difficult to individually help you with use of the HipScreen app. So we hope you go to the hipscreen.org website. There's lots more practice x-rays that you can download with the answers included. And I'd like to also thank our 4 experts who participated in this symposium, and we'll open the floor for whatever questions there are in the time remaining. And thank you to all of you for participating in our tutorial today. All of this information will be available on the HipScreen website, so please check it out. Have a wonderful day.